My name is Michel Haynie. I'm a general dentist in the Salt Lake area, and I love doing dentistry that lasts longer than the dentistry I used to do. We're talking about air abrasion as it pertains to the practice of dentistry. We know that air abrasion increases all bond strengths, no matter what bond system, no matter what bond technique, whether it's self-etch or complete and total etch, it increases bond strengths. It also allows for preparations of teeth, small cavities, without any anesthetic. It allows us to remove decayed material more easily than we can do with the traditional rotary instrumentation, the hand pieces, the high speed and the slow speed, all the bumpy, noisy, whistling sounds the patients love. They miss out on all that when they get to use air abrasion. Air abrasion allows us to work with little kids and with primary teeth. And we can do things for primary teeth you can't do for permanent teeth, of course. But if we can work with little kids and we don't have to hurt them, and they don't have to be injected, and they leave, and they're all happy, the thing that they remember most is the little toy in the prize box at the end of the appointment, and not how bad it was at the office. There are many kinds of air abrasion systems available. Many include water, and the water is used to try and tame somehow the wild plume of material that's flying out of the patient's mouth and coating the office. And that mess has been the single most influential turnoff to almost every dentist. They hate the mess, but there are ways and means, there are machines that are available today that put out very little mess, are very comfortable, very easy to use, have a variety of modalities worked right in. They don't use water. The water creates more of a mess. It's wonderful to be able to use, by brand name, one is a Crystal Mark. It costs about the same as all the rest of the machines, but it actually works. It works efficiently and quietly and without the mess. Did I say it? It's not messy? It's really a problem. The mess is such a huge problem in dental air abrasion that almost every dentist has the opinion, I'll never put that in my office. I have tried it someplace, and it was such a disaster that they've sworn off completely. It's worth it to take just a moment and try the one that says it doesn't make a mess, because it really doesn't make a mess. And it's worth it. It really does things that are amazing. There's air abrasion in just about every preparation we do. If it's a big filling or it's going to be a crown or an onlay, we use air abrasion underneath it and coat it all with wonderful materials. And then when it comes time to put the crown or the onlay on, we air abrade the materials we put down because it sticks better. In every way it works better. But we use it a lot for kids, and we use it a lot for the kinds of fillings that don't need anesthetic. This has very specific uses. And when it comes to cavity preparations, it's the one machine we turn to for the smaller cavities. And we can do those without anesthetic, adults, young people, teenagers particularly. Unfortunately, most adults have wall-to-wall silver fillings already, and they've already been mutilated by big rotary instruments and monstrous fillings, and we can't go back and undo that with this technique. But we can really delicately and very precisely do fillings that are so much more conservative and so much more long-lasting. They may last a lifetime. Some people have said, 20 or 30 years for a good bonded restoration. The littler they are, the longer they last. Maybe they last a lifetime. And they're really wonderful. We couldn't say more about the importance of air abrasion in our practice. G.V. Black, at the turn of the last century, described how to do classical dental fillings. We don't do anything like he did ever in our office. We don't put in sharp internal line angles, we don't blow things wide open, we don't grind away things just for prevention. We only treat that which needs to be treated, and we preserve so much tooth structure that the teeth last so much longer. Nothing is better than natural tooth structure that's strong and healthy and massive. This is such a paradigm shift. Early diagnosis and early intervention. This is taught by the masters of minimally invasive dentistry. Early diagnosis, early intervention. If you can find the cavities, the decay process ongoing in a tooth, in the pits and fissures of teeth, and you eliminate that, and then seal it completely with a good bonding system that bonds well to air abraded surfaces, it lasts very, very long. I don't know how long it lasts. We haven't had enough of them out there long enough to know how long they last, but maybe they last 30 years or 40 years, or a lifetime. It would be wonderful to think that way. Otherwise, you just wait and say, well, you know, I can't really, you know, I don't see it on the x-ray, although I can look at it, and it doesn't look real good, but it's not on the x-ray. X-rays provide lots of false negatives, but they never provide a false positive. They always show you that there's a cavity there, but the cavity's twice as big as what you can see on an x-ray film. Whether it's digital or whether it's a usual wet film or whatever it is, the x-rays don't show how big the cavities really are. And so just because it isn't on the film doesn't mean it isn't there. And we can get to a lot of things earlier than we ever did before. Early diagnosis, early intervention is the only way to go, and air abrasion is key for that kind of a process.